many as 51 million people in the U.S. have schizophrenia. Today I would like to inform you on this mental psychotic disorder. Any one of you or someone you know could develop schizophrenia at any time. It's one of the leading psychotic disorders in the U.S. I've always wanted to go in psychiatry, so I've done a lot of research on schizophrenia through books, articles, and videos. So today I would like to tell you what schizophrenia is, what causes it, and how it can be treated. First off, schizophrenia is a mental psychotic disorder that affects how a person thinks, acts, and feels. Mental Health America states that it's usually developed in early adulthood. However, in some cases it can be developed in early childhood. It's categorized into 5 different types. The first is going to be catatonic. Catatonic is where the patient has rigid muscles and they may have little to no response to external stimuli such as pain. They usually put themselves into like bizarre body positions and they look uncomfortable, but they will resist anyone trying to move them. Another behavior from catatonic schizophrenia is going to be hyperactivity. They may walk aimlessly around in circles, they'll mutter things, mimic people and gestures done around them. The second category is going to be disorganized. Disorganized is where they have incoherent thoughts, they may have hallucinations, they appear childlike sometimes. Because they can't make cohesive thoughts, they have trouble speaking and writing sometimes. They also have trouble doing like simple activities like bathing themselves or getting themselves dressed. They also show inappropriate emotions sometimes. This means that in a serious matter, they may burst out laughing. The third type is going to be paranoid schizophrenia, and that is where the patient can be angry, violent, they have hallucinations, they may have a false sense of entitlement. Most of their hallucinations are going to be auditory, meaning they hear voices, and sometimes the voices are just having a conversation in the background. Other times they're telling them what to do, they may be insulting them. Without treatment, this type of schizophrenia can be very dangerous. It can lead one to suicide. So the next one is going to be residual. Residual is where a patient may have some symptoms still from schizophrenia while others have gone away. Or it could mean that they may have only had 1 or 2 episodes of schizophrenia in the past, and since then the symptoms have gone away. And then the last type is going to be undifferentiated, which means that they show symptoms from all different categories. However, it's not enough from just one category to be classified as that one type. So now that we know what schizophrenia is, let's talk about what causes it. It's found there's no single cause of schizophrenia, but through research and experiments, doctors have found that the brain typically is not wired correctly. Therefore, they cannot communicate correctly either. It's also seen that not only is their brain a different structure, but so is their central nervous system, and parts of their brain are actually bigger than other people's. It also shows more or less activity in the brain than most people. Another cause is the imbalance of chemicals and neurotransmitters. Neurotransmitters are how the brain communicates, the brain cells. Types that are affected by schizophrenia are the dopamine and the glutamate. And then another cause is going to be development before birth. It's shown that the brain tissue develops differently, the brain cells also distribute differently before childbirth. And then of course environmental conditions like exposure to viruses, malnutrition, heavy marijuana use, this can also lead to schizophrenia. And the last is of course genetics. If it runs in your family, you are a lot more likely to develop schizophrenia. WebMD actually found that 10% of those with schizophrenia have a first-degree family member with the disorder, meaning a mother, daughter, father, son. So now that we know what causes schizophrenia, let's talk about treatment. There are a few different ways to be treated for schizophrenia, first being antipsychotic medications. Most people are put on antipsychotic medications with schizophrenia. However, depending on the category you fall under, you may resist taking the medication, and that's where it becomes a problem. However, most patients do see a reduction in their symptoms, but another way is going to be therapy. There's a few different types of therapy, the first being individual therapy, and that's where the patient just focuses one-on-one how to cope with their symptoms, how to manage them, and function better overall. The second is going to be social skills training. This is where the patient really focuses on their communication skills and their social interaction, because with most categories they have a lot of trouble with that. And the third is going to be family therapy. This is a good therapy because it not only has to do with the patient but their family as well. It kind of tells the family what to expect, how to help them manage their symptoms, and so on. And the last is going to be vocational rehabilitation. That's basically trying to get the patient out in the real world. It focuses on learning to cope with their symptoms so they can find a job and keep one. So now that we've talked about what causes schizophrenia, what it is, and how it's treated, I just want you all to remember that it's one of the leading psychotic disorders in the U.S., and so educating ourselves is important. And after today, I hope you can walk away feeling like you know the disorder